welcome everybody to today's session looking at issues of texting and email with patients. And we'll be looking at how you handle patient communications is a big part of it, and looking to see how email and texting can actually work under HIPAA, and making sure those things that you do as far as communications are allowable under the rules. We'll look and see what kind of guidance there is from Health and Human Services for patient communications, and there is plenty of it actually. And we'll identify the various HIPAA policies along the way that you may need to adjust in your own organization. As we discuss things as we go along, you'll be looking and seeing, do we have that written down in our policies to work that way? You may need to reevaluate some of your policies in light of some of the guidance that's out there. It's not a surprising thing these days. There have been some surprising sort of clarifications over the years. We'll also discuss things like individuals having rights for getting electronic copies of electronic records. And if something goes wrong as far as sharing information is concerned and communication is concerned, something may result in what might be termed as a breach. It might be something that might involve a inappropriate acquisition, access, use, or disclosure of somebody's health information. And when that happens, you may have to report that. So we'll look at that sort of thing, what happens when things go wrong. We'll have to at least consider that. And really what we're doing is making sure that you're ready for things like enforcement actions or auditing or any of those kinds of things where there's a knock on the door and your friends from Health and Human Services have some questions for you, either because somebody's made a complaint of some kind or you've been selected for some kind of random review or something like that. So you have to be ready to answer these questions when they come along, and so a part of it is making sure you're doing the right stuff all the way along and then documenting that so you can show you've done your best to make wise decisions as far as compliance is concerned, and have plenty of backup for how you handle things. And it's important to have plenty of documentation about that. So that's really one of the key things about compliance, is making sure you understand what your processes are and following those and having those things properly documented. So if there's any questions, you can say, look, here's what we do. Now, my own background, as was mentioned at the initial slide there, I'm not a lawyer. This is not legal advice. I'm just providing some information and resources. It's the sort of thing that I've been involved with HIPAA compliance for quite some time now. I suddenly realized that it was half of my professional life was taken up with HIPAA compliance these days. It's kind of a shock when I look at the numbers. So anyway, it is something that's a focus of my background, and I come at it from an engineer's viewpoint. In other words, I like to break things down that are complicated into more easily understood things, so that it's possible to be able to go ahead and make some conclusions about what you should or shouldn't do by being able to understand some of the bits and pieces. Anyway, that's my approach to things, and also something that you can take advantage of. Probably the most important thing on this slide, anyway, is the link to my own website at lewiscreeksystems.com, where there's all kinds of resources and news stories and links to the regulations and guidance and toolkits and all kinds of stuff out there. I mean, pretty much anything I find out there that's useful and I'd like to be able to find again as far as HIPAA compliance is concerned, I have a place to post it out of my website. And so there's lots of stuff that's been amassed there over the years. It keeps growing. I probably have to go through a process of reorganizing it again, ideally, but at some point I'll have to get to that. In the meantime, take advantage of what's there. You don't have to register. You don't have to log in or anything like that. Just go make the stuff that's there available to yourself, because it's there. All you have to do is just go visit, and there's all kinds of things that can help you with HIPAA compliance work. So please do so. Now, what we're talking about is the HIPAA privacy and security rules in large part, because this is really where a lot of this communication stuff comes from. And we're looking at, one aspect is the privacy rule under HIPAA. That's been enforceable for 15 years now, which is, actually quite, I guess it kind of makes it the annoying teenager age, I suppose, maybe. It's been enforceable since 2003. And what it does is it establishes the framework of the relationship between individuals and the organizations that have their information. It establishes the various rights that individuals have, and then also puts the controls in place on the organizations who are holding that information as to how they're allowed to use or disclose that information. Okay, and so one of the key things, and one of the things we're talking about today, is people having rights to have access to their information. And in fact, I was just reading today another news story about another high-tech startup that's purpose in life is to make access of information go easier and go better. and go smoother, make it possible for people to have the information they need so they can be properly taken care of. This is a personal mission of somebody who's running this company, who's had to suffer through having his younger sister die of cancer, and in the process of that, becoming exposed to all the horrors of how difficult it is to have access to your own information, to be able to provide up-to-date information to your various caregivers so they can do the right things for you. And he wants to make sure this doesn't happen anymore. It's become a personal mission for him to do this. And he made a promise to his sister, and so I applaud him for working on doing something. He said, I'm going to do whatever I can to get rid of cancer in my lifetime. So that's what his focus is right now. And he's hired some top people to work for him. But anyway, so it's in the news all the time, okay? And this problem has not gone away despite having the requirements in the HIPAA regulations for 15 years now, okay? And so this is a hot-button issue for Health and Human Services. They are sick and tired of these stories of people having a hard time getting their information. It's absurd in many cases that it is so difficult to be able to pull together a medical record. How has it come to pass that medical records in many cases are managed so poorly that being able to actually grab the stuff and use it is nearly impossible? What good is that? So don't get me started on something I get cranky about. This is, as somebody who's comes from an engineering viewpoint and understands how systems work and has been involved with software development for a good portion of his professional life. Probably gets as much as HIPAA these days. But I understand how difficult it is to do this kind of stuff. But if you approach things with an organized mind, you can actually sort this stuff out. The problem is health information exists in all kinds of different formats and silos, and it's a mess. So I think it has to be everybody's priority to make it easier to have access, and that's one of the things we're talking about today. So let's make sure we do this right and make sure we become champions within our own organizations for making it easier for people to have access to the information the way it should be. And after all, we need to take care of ourselves, and that's what HHS sees as a priority. They're not kidding. They keep talking about this for years and across multiple administrations. So this is not just a flash in the pan kind of issue at all. It's not going away. Security rule has been around since 2005. It's the pimply faced kid if it's 13 years old, I guess, right? And it's the one that's just dealing with all those those just coming of age kind of issues. And but part of the problem we have now is we're realizing how bad a job we've done in terms of keeping track of what people are doing with all this electronic information. Security rule applies to electronic information only. It works in conjunction with the privacy rule. It's very flexible. It's very customizable. Part of the problem is that you have to be aware of what you're doing enough to be able to understand how to put the right safeguards in place. And so you have to do a good risk analysis. And organizations in many cases have failed to do a decent risk analysis at all and miss entire categories of communications and things like that. And go, oh, yeah, sure, yeah. Oh, our doctors all communicate using plain texting that comes on the telephone. Oh, they do? Involving protected health information, involving patient identifiable information? They do? Well, I've got a clue for you, folks. It's been advised against by our friends at Health and Human Services. They say that's something you can't do. So first thing is you have to tell the doctors, no, you can't use the texting that comes built in on your phone for texting of patient information. It's not allowed. It's against the rules. You'll be in big trouble with HHS if they find out about it, okay? So you got to stop this. These things happen. It just, well, how are you using, why is this texting happening? Well, people just started using it. Well, you'd be forward thinking enough to do a good risk analysis and say, well, what are we doing for our communications? Whoa, Nellie Bell, wait, we're doing what? We're doing texting of patient information using the stuff that's built into our phones that's not properly secured, that's not properly protected information. You realize how dangerous that is from a regulatory compliance standpoint? Oh, goodness me. So anyway. But the other thing is too, you also have to be, since you have to be aware of what the issues are with information you have stored or information you're transmitted, but you also have to be aware of what the requirements are in the privacy rule. And that's part of the whole issue we're talking about today with patient communications is patients have certain rights to communicate in the way that they see fit, including a right to request communications that wouldn't necessarily be secured. They're allowed to say, I don't want to deal with your silly secure website to have access to my information. I want you to just send it to me via plain email. You have to be able to consider that request, and you have a hard time denying it. because that's a right under the privacy rule to communicate in the way that you see fit. The security rule provisions are, evaluate the circumstances and secure what you can. And if you look at stuff going over the internet by plain email, you go, well, you better make sure you secure that because that's not secured at all. That information could be, retained by anybody around the globe. But anyway, the patients have rights to do things that they want, and so these things have to work together. These rules have to work together, and so the security rule has a lot of flexibility. It doesn't absolutely require that you use encrypted email only. It requires that you consider the need to use encrypted email, and for professional communications, you'd better do so. You better use encrypted texting as well. And when it comes to patients, though, they have rights to request what they would like to do with you. Professionals always have obligations to do things in a secure way when it comes to communicating over the internet. The breach notification is what you have to deal with when things go wrong, and you hope that you don't have to deal with this. It can be very expensive to deal with. The nice thing is, though, we can learn a ton of stuff from what's gone wrong for everybody else. And when you look on the wall of shame, which is where we all call it that, but HHS doesn't, but that's where they post the large breaches that affect 500 or more individuals. Okay, and what you'll see there's a lot of hackers and ransomware incidents and things like that. But if you look at the data over the years, you'll see there's this underlying residual problem that refuses to go away, having to do with portable devices and laptops that contain protected health information, and they're lost, stolen, or improperly disposed of, and they aren't properly encrypted, and so that winds up being a reportable breach. So this is, memory sticks, flash drives, all this kind of, CDs, DVDs, backup tapes, smartphones. I mean, all this stuff that may have PHI on it. If it's not properly encrypted, if it's not properly secured, you lose this stuff, or it gets stolen, and you got yourself a reportable breach on your hands if you have any health information on it. Okay, so the idea is to, this is a problem that we can all make go away. And in fact, HHS gets pretty cranky with you these days if you report a breach like this. Say, what is the matter with you? Haven't you seen this is one of the biggest problems that's existed over all the years of breach reporting? It's been going on for 8 years now. We've been doing breach reporting. Okay, we're looking to see what a consistent major problem that should be easily recognizable is the whole issue of encrypting these portable devices. Okay, when we're talking about communicating with patients, okay, part of this may include a conversation about how you're communicating with the devices on your end, and are you using portable devices? And are these things being used properly or not? Are you using, texting with your patients? And if so, how? And on what kind of device? And how do you manage this process? Okay? So there's a lot you have to think through in terms of how you protect your information, but you can look and see there's some obvious things not to do. One of those things is to make sure that you better make sure that you do secure your portable devices, because these days it is almost trivial to do so in most cases. It doesn't really, in most cases, require any extra expenditures or overhead. You just kind of throw a switch, and guess what? Now it's all properly secured. Well, please, let's just do that, shall we, if we haven't already? A couple of other links on this slide here are to the preamble to the major update in 2013. That's important because now the key thing about any new rule that comes out is they have a discussion in the new rules. And the last major update was in this one in 2013. Okay, they have a discussion up front where they say, well, listen, the law says we need to make some changes in our rules here, and so based on what the law says, here's what we proposed or put out as an interim rule. And so during that proposal time there and during the interim time there, we had a comment period in which people could send in their questions and comments about the proposed rule and about what they thought were issues and ask for some clarity on some of these things. And so what happens in the preamble is they take all these comments and questions and say, well, here's what we're supposed to do. Here's the comments and questions we got. Here's our answers to all these comments and questions. And because of all its consideration, here's what we're putting in the final rule. Now, in all that discussion, they discuss a lot of key issues that people have questions about. One of which that shows up in the preamble for the update rule in 2013, the last major update, and it shows up in many places. Is the question of, is it okay for us to communicate with the patients using plain email if that's what they want to do, if that's what they have asked to do? The question always comes to say, hey, the patients send me a plain email message. Can I just reply? Well, the thing is, what they say is, well, yeah, the patients do have rights to communicate in the way they see fit, so what you have to do is make sure you explain the risks to them, because there are risks of plain email being exposed. So what they say in the preamble is, is that, yes, what you can do is explain the risks to the individuals so they understand that there is a risk involved, and get their consent to go ahead anyway if that's what they want to do, and have that documented, and then you're all set. Then you can do whatever you want, and if something goes wrong, it's not your fault. Okay, I mean, this is just for communications between the patient and the professional. The patient cannot just waive the obligations of the covered entity to use secure communications, like it's between the offices or between professionals or between the doctor's office and the doctor or whatever. You know, all these things have to be handled securely, but the patients have rights to communicate in the way that they see fit. It's part of their access rights. And so they have this discussion in the preamble. There's so much juicy stuff in the preamble to a major update. You really need to read it because, you know, it's important to understand what a lot of these questions are, what the answers are. It helps you understand how to interpret the new rules. And another nice thing about it is once you've read through all this information, you've got a really good feeling for how the rules might be enforced, because the preamble is written by the same people who enforce the rules. And so it's a good idea to find out what people are thinking and get some good background. So take advantage of that. Also want you to make note of the link at the bottom for the combined rules as of March 2013. That's the latest collected update of the rules. About a couple of minor changes since then. But if you just know what the rules are and you want to know, well, how are things put together, how are things laid out, you can download a copy of the rules or access a copy of the rules. I kind of like looking at the PDF version myself. But what you want to do is get familiar with what's in the rules. Okay, if you're dealing with this kind of stuff for communications purposes or dealing with your patients or whatever, you need to get to know what the rules are. Okay, so I'm going to give you 10 minutes a week homework assignment. Your first week's assignment is to get a copy of the rules and just look at the table of contents. Okay, and while you're looking at the table of contents, you may notice there's a number of sections that say definitions. They show up in many places throughout the rules. And so the next thing for your next 10 minutes a week assignment is to read those sections that have definitions. So by the time you're through with those two assignments, you have some idea of where things are in the rules, where things laid out, where are the transactions, where's enforcement, where's privacy and security and reach notification, okay? And you'll have some idea where things are in the rules and what the words mean, okay? So it's an important thing to do to get familiar with this kind of stuff. So what are you allowed to do? Okay, you want to do what the patient wants, first of all, to the best of your ability, because happy patients don't complain to HHS is really a key thing to think of. But you want to meet the HIPAA requirements to meet the patient's requests and accommodate whatever you reasonably can. That's the key thing, is to consider what you reasonably can accommodate. When you're talking about communications, there's lots of reasons you may need to communicate. Okay. For various things like prescription renewals or scheduling or particular issues or getting test results or accessing records or whatever. But the important thing is to make sure that you do what you can handle properly for purposes of taking care of the patient and for your medical records purposes. You have to be able to triage messages as they come in and refer them to the right person in the office for them to be dealt with. Okay, there's all kinds of reasons you might get a communication. Okay, so the same thing like, oops, pardon me, not really sure why the picture just fell through. Oops, sorry about the noise in the background. Sorry, it fell off the wall. I'm not really sure why it fell down at this point, but there it is. Anyway, surprised me. Anyway, so you have to do what you can handle properly for patient care purposes, because you have to be able to triage these messages as they come in and respond to them in such a way that you're taking care of the questions that come in. And you also have to be able to document these things. And using something informal like just the texting that comes with your telephone from your cell phone, that doesn't necessarily give you everything you need to be able to document the encounter, the conversations that you're having. So you have to be able to have some kind of means of communication that you can manage. Okay, you have to do it through a process that you can handle properly. Let's see. So you want to make sure you do what the patient wants is to the best of your ability, but also make sure you can handle the process. So the HIPAA considerations are, when you look at the security rule, that's in 164.312E. Okay, what that requires is that you consider the encryption of communications. It's an addressable specification. Okay, so what it means is you have to look at your communications and say, should this be encrypted or not? And if you look at something like texting or plain email, you go, well, it's not secured. There's no way that it's protected all the way from end to end. It could be, like a text message can wind up being stored on the phone company's server for some period of time, you know, if the phone isn't on when it's first attempted to be delivered, so it could be saved for a while before it gets picked up. So, you know, you can't just leave this stuff out there full of health information. It's, you know, you have to make sure you protect it. Okay. Well, the privacy rule gives patients rights of communication, preferences, and access, and that's in a couple of sections where they look at this and they discuss these things in the various sources that I found. But again, the idea is to make patients happy, because if you have happy patients, they tend to they make less, you know, the fewer complaints to HHS. Okay, they make less trouble for you. They tend to make fewer complaints to HHS, and you know, the more you can give you know, the more you can avoid giving them reasons to knock on your door, the better off you're going to be. So make sure that you're prepared to consider these kinds of questions, because patients who have these rights to communicate that you have to acknowledge. Okay, even if they're asking for something wacky, if they say, listen, the only way I'm going to communicate with your office is via Twitter only. Okay, well, you got to be prepared to at least receive that request and then act upon it. Okay. When it comes to professional communications, though, when you do the proper risk analysis, you'll see that using insecure communications like plain email and texting just you just can't do that. Okay, the risks are there; they're clear. Even though you're not really sure if something has gone wrong with email, that's part of the problem with emails. It was never designed for being able to be tracked and be secure or anything in the first place from the get-go when it was first designed. It had nothing to do with what's used for today. It was just sort of a informal communication process for people who are running these big networks. Okay, well, they got hijacked and used for all kinds of purposes now. So we get, you know, we use the technology in ways it was never intended. But anyway, so, you know, there are definitely risks involved with plain email and texting. And organizations that discover they've used something insecure quite often report this kind of thing as a breach. In other words, if somebody sends home to their home Hotmail account, here's a list of my patients for next week and their expected outcomes for the kind of cancer that they have scheduled to be taken care of. Well, you know, that's the sort of thing that, you know, you don't want to be having that kind of information going out in a bunch of stuff that's going to be potentially scanned to see if somebody should market to you or not. And you don't want your patient information to be something that your free email system is scanning to decide what they should market to you. And, you know, in fact, you know, Google had told people for years that, hey, listen, we are reading your email to find out what we should send, you know, what kind of marketing pieces we should send your way. Well, you know, the lawyers have been having a hard time answering this question. Does that make using, you know, a plain old Gmail a breach? Well, what they've said is that it's not really clear, because who is reading the email? Is it just a system that's scanning it and then making recommendations? But does that wind up being, you know, some kind of a breach of the information? Or does it, you know, it's just the fact that it starts generating certain behaviors based on the information it finds? Is that the kind of information that could be, you know, inferred back to find out who the information is about? I mean, there's lots of you know, unknowns when we start looking at these kinds of things. So it gets scarier and scarier. And when you have lots of unknowns, you know, the less sure you are about how protected your information is, the more likely it is that you have some kind of a problem with it. Okay, so. And also, some of the enforcement settlements have been based on using insecure email for professional communications. And also, the CMS and the head of HHS, Office for Civil Rights, say that it must be protected. So, you know, when the guys who are in charge of it all say, hey, you got to make sure you protect this stuff, you better pay attention to that. You have to be flexible with your patients. You have to be able to, you know, consider a variety of means of communication. You want to be able to have available to them a secure process for communications and have that be your first choice for communications with them. But you have to be prepared to deal with something that may be other than what your regular preferences are. So you have to have policies and processes for considering the requests from patients to be able to communicate in certain ways that maybe you haven't been already, or maybe you have been to certain individuals. You have to be able to, you know, understand when these requests come along, how do you deal with these things? And what's the process that you use to make sure that you handle it appropriately? Because here's the thing: is email and texting are, you know, inherently secure by default. It's just the way it is. They're not secured. They could be retained or exposed by unknown parties and who knows where. And secure email solutions for general use are sometimes a pain. It winds up having to, you know, not really even be email. Sometimes it sort of refers you out to a web-based system for communications. That sort of winds up with fragmented communications. Personally, I hate using these web-based systems. So I'm a big proponent of being able to, communicate however I wish with my providers. And also, if you use a poor password, it's easy for somebody to guess the password and you have access. So when it comes to professional communications, it's essentially required as good practice. You have to make sure you use secure communications for professional purposes. And using all these consumer-grade things are not necessarily secured, and so using them for professional purposes could be considered a breach. You have to evaluate these things very carefully to see whether they're reportable or not. There are things you can do to secure communications. You have to make sure you consider this and apply it wherever you can, and have it available whenever you need it. Now, a lot of people will prefer email to telephone. It's great for scheduling and reporting of status and inquiries about things, or getting copies of records or communication of test results, perhaps. It can be more accurate than the telephone. And the nice thing is it does give you a documented record of communication, so long as the email doesn't have too much auto-correcting going on that turns all your words into something you didn't mean. You have to make sure you review stuff that you type these days very carefully, because it could be changed to be something that you didn't intend. Your typing mistakes are not any longer identified as typing mistakes. They just turn the words into other things that make no sense. Anyway, so you have to be very careful when you're dealing with communicating certainly by email, because it's not secure. But you look at this, you see there's a whole range of reasons why people may want to communicate. Okay, whether it's just when's my next appointment, or is it how are things going, or what about how do I deal with treating with this particular issue that I've got here? What about communication of test results? Okay, now see, in my own particular case, I'm a former redhead. Okay, and I as a child of as a boomer who grew up in the 50s and 60s. Back in those days, what you did was, as a redhead, what you did was you went out on the beach and you burned yourself 3 or 4 times, and that got you a pretty good base going for your tan for the summer. That was sort of how you handled your tan. So, of course, I'm paying the price for that now and dealing with all kinds of stuff. I have a wonderful relationship with my dermatologist, which is a great thing. I just hope she doesn't retire before I don't need her services anymore. But anyway, she's always, freezing things or taking samples. And once she called me and said, "Oh, listen, Jim, those last 2 samples we took, actually, they turned out to be positive." And, you know what that means. I mean, that means that, "Oh, Jim, you have cancer." It's the big C, right? Your brain stops working entirely. Now, she goes on to explain to me which sample was which, was created which way, and what kind of carcinoma was it, and this sample was like this, but this is fine because of that reason. This other sample was like this. And, okay, that's all great, and I thank you very much. I listen to all this stuff and I take it all in as best I can, Then I get off the telephone and I realize I have no idea what you just told me. Okay, my brain literally just froze. I mean, and this the crazy thing is, I know this is not a problem in my case. I know this is something that's manageable. I know it's the kind of problem that we have in my family. My mom is now 95 years old, and she's been dealing with this problem for 30 years herself. So it's not really something that gets out of hand so long as you pay attention to it, so long as you stay on top of it. And so, so long as I pay attention, it's okay. It's not going to be the end of me. It's not like it's some kind of a carcinoma where it's like, oh my God, what are we going to do? Jeez, it's like, is everything in order? It's not that kind of a situation. Okay, it's just a thing that means I have to stay on top of a problem. Okay, but still, I have a hard time thinking about what she's saying. Now, I would have preferred to immediately receive an email copy of the information that we just discussed. Okay. Instead, I don't want to bother her. I don't want to call her back and ask for another explanation because she's a very busy person. She has other patients to talk with and things like that. So I don't want to bother her. I would just I'll just wait and see what comes in the mail. So I have to wait a few days for the thing to come in the mail. It explains to me the differences, and now I can actually adequately discuss it with my family as to what the issues are or aren't, and what's going on, and not sound like an idiot because I have no idea what the doctor told me. So anyway, that's fine for me, but. So I wouldn't mind that. But if I were a high-fashion model, okay, if I wasn't some old guy who just happened to be a former redhead who's dealing with the issues of getting older, okay, well, if I wasn't just some old guy, if I was a high-fashion model whose skin was an important asset as to how they're going to get jobs and what kind of career they had, they may feel very differently about this information. Okay, and so you can see one of the complexities of this is that there are different levels of kinds of preferences people may have for different kinds of communication about different kinds of things. But different people will have different preferences. So you may have different kinds of communication You may have different things to communicate, and you may have different preferences for each purpose. For each person, you suddenly wind up with this matrix of preferences about who wants to communicate in various ways, and you have to somehow keep it straight in terms of who wants to be communicated in what process about what kinds of information. So it's not at all a simple thing to take a look at. It gets messy very quickly. That's the whole thing about it. Once you start dealing with another medium of communication, you have to make sure you are prepared to deal with all the wrinkles of that. Now, likewise, look at texting. Texting is great for things like, update schedule changes. If you're running late, it's real easy to use. It'd be a lot better than an email or telephone call in a lot of circumstances. It'd be a lot more private and discreet than a phone conversation, certainly. A lot quicker. And again, it can be more accurate so long as your autocorrect doesn't change everything that you've said into something else. But again, it can be the kind of thing where the texting can be a better, more reliable source than the voice. But texting is not free of its issues. I mean, with privacy and texting, the whole issue is we don't really know what the problems are going to be. I mean, with email, we knew what the problems were when the Sony breach came along. That we knew that everybody's email was not necessarily private. Okay, all your information could be posted on the internet for the bad guys to laugh at and for all your neighbors to read. Okay, well, that was how many decades were we using email? A couple or a few decades we were using email before we had that to explain to us what the issues are with using email. Now, we haven't been using texting long enough to find out what the issues are, really. So we're still going to be finding out what the downsides are somewhere down the road. That's the whole process with using all these new technologies. We're having a really hard time as a society understanding what these things mean and what their impact is going to be down the road, and understanding what the impacts are of certain decisions we make today about what might be reasonable to use or not. Well, the fact is you have to do try and do what the patients want to the extent they wish, but you have to try and explain the risks. And of course, and it's also a medical records thing, because you have to be able to document this stuff. Regular texting isn't going to make that easy. If it's part of patient care, you got to make sure you do a good job. And of course, when it comes to professional purposes, you want to make sure you use something that's secured. And it's also a patient safety thing. If you're communicating with the outside world, with your patients, you have to make sure you have these messages routed to the most appropriate individuals, and make sure you have things like, say, hey, this is, the office is closed. If this is an emergency, please hang up and dial 911. Okay? I'll have to be able to handle all these various circumstances, and offices being closed and people being on vacation. You can't establish a one-to-one relationship between a patient and some individual caregiver in your team there. That's crazy. It won't work. Okay? A person can never take a day off. Okay? Well, you have to make sure you manage this stuff. It's something that has to be managed. There are some secure texting solutions out there. I like to recommend that medical offices, what they need to do is medical offices need to do their best to ensure that all of their texting communications are done securely and use a different app than the one that comes on the telephone. Okay? So the idea is, yes, there's texting that's built into your phone. Why not use that? Well, it's not secure. But there are free versions of things like Telegram and WickerMe and Signal that you can use just for a straight texting capability, okay? But without any kinds of, documentation capabilities or reporting or things like that, but just for straight texting as a replacement that's actually secure, you can use Telegram, WickerMe, or Signal, and you'll have some certainty that messages are actually communicated and things like that, and you can handle lots of capabilities just with the free versions that they've got. And what you do is make sure everybody who works in the office uses that app and that app only for communications for business purposes. And that's a good thing, because that separates your business communications from your personal communications. You can't mix this stuff up. You can't try to send a message to one of your patients and make a mistake and send information about the patient to one of your family members or something like that, or one of your friends or something. I mean, you have to make sure you're very careful about this stuff, and the more you can keep this stuff separated, the better off you're going to be. One of the best ways is to use a separate secure app, and then you don't even have to worry about if there's PHI involved, okay? Now, you can't use even secure texting for physician orders, so patient care orders cannot be delivered via texting of any kind, whether it's secure or not. But for other kinds of patient care purposes, where you're, communications within the care team, things like, Mrs. Smith is in room 2 and you're ready for her blood work, and things like that. Whatever kinds of things you want to say, these are things that you can do securely essentially at no cost. And you can upgrade these things to get versions that will give you abilities to have documentation of your conversations and reporting on conversations and things like that. Those do cost a little bit. You have to upgrade to paid versions to do that. But as far as just a raw texting app to use instead of the one on your phone, use this. I mean, look, it'll have a different tone on it when you get a text message, so people will know if it's their family texting them or if it's business purposes, and they'll be able to tell the difference, and so will everybody else too. There's all kinds of other alternatives here as well. I'm not going to go into them in great detail, but I do like particularly OMD if you're interested in something that's sort of a patient-oriented kind of a communication solution that you can integrate with your medical record systems and things like that. So anyway, take advantage of the various links on here to do some exploring, but certainly you can take a look at these secure apps as ways to handle communications. Now, what the Joint Commission said, well, yeah, using secure texting, it should be okay. They said that in April of 2016. They said, well, here's how you do it, and it should be secure in these ways, the various attributes. It all sounded pretty good, right? Well, then a couple months later, they said, oh, no, actually, we need to have more guidance before going ahead. See, what happens was, they said, well, listen, we need to make sure that the texting is properly authenticated and aligns with Medicare conditions of participation. What they're talking about is the fact that when it comes to physician orders, these are things that generate charges, and so they have to be properly authenticated. You have to make sure there's no phony charges going on. Otherwise, you wind up with fraud and abuse issues, and that's no fun to wind up with that. So, well, hold on before we go ahead. And eventually, in the end of 2016, they said, yeah, actually, we really can't use texting for patient care orders, even if it is secured. So that the Commission did a big, follow the path of yes or no through 2016 when it comes to texting and patient care orders. Now, but also, they're not the only ones who have had things to say. In December of last year, CMS told their state survey agency directors, okay, so these people who are in charge of enforcing the rules, so they're telling them, here's what the rules are. What they're saying is, texting a PHI within a care team is permitted only if it's secured. That means it has to be encrypted. So if you're doing any PHI, any protected health information between members of a care team that's texting, it has to be properly secured. You can't use the plain stuff that comes on your phone. And texting of physician orders is prohibited whether or not it's secured. This doesn't really affect the HIPAA-regulated patient communications, but it talks about what the professionals are allowed to do. And also, what the other guidance has come out is what passes for guidance these days is the head of Office for Civil Rights at Health and Human Services. I was speaking at a conference, and somebody asked him and said, listen, we've been asking you guys for years, what about texting, if that's what the patients want to communicate using? And he said, oh, well, that should be, it's fine for email, so it should be fine for texting too, right? And so that's what counts as guidance these days, is offhand comments by speakers at conferences. But anyway, he does have the, he is a head of Office of Civil Rights, so if anybody's going to say it, I guess he could. But anyway, so what he says is, if the patient wants to communicate using texting, that's okay if you can handle it. But texting between professionals where PHI is involved, it must be protected. So it's pretty clear you can't really avoid this. Now, also think of when you're talking about communicating these days, when people give you a telephone number or they give you a number that you might text to, what is that? That's a cell phone, right? Okay, well, cell phones are the kind of thing that's controlled under the Telephone Consumer Protection Act of 1991. So when you're communicating to cell phones, I think back to 1991. That was a time when, wow, prehistory for a lot of folks listening, right, probably. Anyway, so you think back to 1991, what did we used to have? We used to have problems with, people calling you at dinner time, and back then there wasn't necessarily such a thing as, caller ID, so you couldn't block certain numbers. You had to answer these calls, and there was always somebody trying to sell you something or trying to collect on a debt or something like that. And part of the problem was also people started calling people's cell phones, because this is when cell phones are, getting to be used, more and more. And one of the problems was that, when you think back to those days, okay, it's kind of hard to believe, but back in those days, when it came to what you pay for with your cell phone, you paid for every minute you talked, and you paid for every character of a text message. And you could easily have your limits blown out of the water by somebody who keeps sending you messages over and over again, somebody who's dunning you and sends you a message every day saying, hey, you better pay the bill right away, better pay the bill right away. And so what they included in the Telephone Consumer Protection Act some considerations for cell phones. And so if there's, if you call a cell phone and leave a payment-related message, that's voice or text, there's penalties for that. And there's also penalties for, without consent, calling a cell phone and leaving a healthcare-related message, such as a reminder or something like that, more than 1 minute of a voice message or 160 characters of text, no more than 1 per day or 3 per week. So if you have somebody who has 4 appointments with you this week, and you've sent him 4 healthcare-related appointment reminders, then you've already broken the rules. Okay, so you have to make sure you have consent. Now, luckily, it's not as dire as it may seem. There's been a court action just in the end of last year that did help things out a little bit. So, if you're talking about any calls or text relating to billing, you want to get your consent up front to be able to call people. And you also want to the idea is to if possible, when people are giving you their initial information as part of the intake process, you can get consent up front to call or text the number provided for healthcare and financial purposes, including reminders and follow-up. And that means that people can give their consent to call whatever number is provided for whatever purposes they need to, and that covers you if it's a cell phone. Okay. And under the TCPA, the consent has to be written, but also what was decided in a court case just the end of last year was that it would consider to be provided. The problem was there was somebody who decided to sue a doctor's office or to make a complaint to the feds under TCPA about a doctor's office that was sending him health care reminders. And he said they shouldn't have been doing that. They aren't allowed to do that because they don't have my consent under TCPA. So what the judge said was, well, listen, you provided them a telephone number, okay? And they say in the Notice of Privacy Practices that we might contact you for healthcare follow-up, for healthcare operations purposes and follow-up and things like that. And you signed the acknowledgement that says that you received the Notice of Privacy Practices, okay? And that says we may contact you. So, if the patient provides a phone number and says, yes, I've received the Notice of Privacy Practices, and that notice says we may contact you for treatment, payment, and healthcare operations, using the information that is given to them, okay, that counts as a consent, okay? So because people did sign that thing that says, yes, I did receive the notice, and the notice says, yes, the notice includes that in it, that they may contact you, and you give them a phone number, guess what? There's no surprise, okay? It's not a TCPA violation, the judge has said. So it's kind of interesting that problem has been solved in that way. Now, of course, one of the interesting things is there's a push now to make it so you don't have to sign to acknowledge receiving the Notice of Privacy Practices. Well, if that happens and they take away that requirement, what do you do for your TCPA consent? You're not going to have that. You're going to have to ask people to give you TCPA consent instead. So it's not going to save you anything if they take away the Notice of Privacy Practices acknowledgement. You'll just have to get just a signature for a different reason and keep track of it differently. Come with a new process instead of just using the process you've got already. Don't get me started on that. It makes me cranky. Now, marketing is if you're making a communication that encourages people to purchase or use something, okay, that's what marketing is, okay? But marketing does not include, under HIPAA, things that are like refill reminders. So unless somebody's paying the pharmacy to make these reminders in such a way they're making money on it, okay? But it doesn't include, also, unless you're making money off it, it doesn't include things about, treatment, case management, or products or services, or coordination of care, all these kinds of stuff. There's all kinds of healthcare-related stuff that, so long as you're not making money doing that, that's the kind of thing that wouldn't be considered as marketing. It's considered, taking care of the patient, okay? So even though these things may be, encouraging somebody to use a particular product or service, in some cases it just doesn't meet the definition of marketing. Now, if it is marketing, you have to have an authorization to use the individual's contact information to reach them. But for healthcare purposes, they're allowed without authorization, things like annual checkup reminders and refill reminders and communications even about adherence and administration of their prescriptions. And also new treatments that are related to what you've been treated for by the entity, but also anything else the entity does, okay? The entity that you're dealing with, once they treat you for one thing, they're allowed to tell you about other products or services that they provide that they're not related to the ones that you were treated for. For instance, one of my providers is University of Vermont Medical Center for their cardiology services. Okay, well, I'm not a kidney patient, but they can certainly feel free to promote to me their new kidney center. Okay, if they so desire. So that's the kind of thing that wouldn't be considered marketing because it's within the same organization. You see, they aren't pushing somebody else's organization; they're just talking about something else that they provide. So if you're using texting for healthcare operations or treatment option communications, make sure you meet the TCPA requirements, and you don't need an authorization unless you have third-party remuneration above costs. But if you're using texting for marketing purposes, you want to make sure you have. If you're using texting for marketing purposes, you want to make sure that you have authorization and meet the TCPA requirements as well. So if it is considered to be marketing, you have to make sure you have the authorization. Now, when it comes to email and marketing, you want to make sure you consider canned spam, which can lead to some nasty penalties. Canned spam covers all kinds of email messages that encourage somebody to do something. So I want to make sure if you're using email that you don't use a false or misleading header information. Be clear about who you are, where it's coming from, what it's about. The fact that it's an advertisement. Give people a way to reach you, some kind of actual physical postal address where they can send you something, as well as information about how to opt out. And then you have to actually honor those opt-out requests quickly and not delay doing that, and make sure that you don't do things like keep emailing people after they've opted out. You have to make sure you put it on your opt-out list. And you can't charge them for it. You can't ask them to do anything more than just say don't email me anymore. Pretty much is what it is. And you're allowed to share the addresses with somebody else that you've hired to help make sure you're complying with canned spam, but you can't use the information for any other marketing purposes. You can't sell it to anybody else. And if you hire somebody else to help you with your canned spam compliance, you have to make sure you're watching what they're doing. So when it comes to text and email-based marketing to patients, again, HIPAA prohibits marketing without an authorization. If it is marketing, then you need to have a HIPAA authorization to use the patient's information to reach out to them, okay? And you need to meet TCPA and canned spam requirements as applicable to how you're actually reaching out to them. So, I'm sorry, just a repeat of the same slide there. I didn't mean to do that. That should be edited out. But also, so keep in mind that, there's lots of places where you can go for communications and access guidance. And so the two places to take a look there are these number of sources that we have on this slide here. Probably one of the most useful ones is the 2016 Guidance on Access by PHI of Individuals. I still call it new because it's the newest there is, but it's been updated a couple of times since then, and includes lots of information on access. And so that's basically, a big topic we're talking about today is having access to information. So you want to make sure that you consider all the various questions and answers they have in this guidance. So if you're in charge of guidance, and if you're listening to this session today, you have reason to get to know the 2016 Guidance on Access. It's very, very useful. It's very, very well written. Read it and learn it. These other links also have connections in them to what we're talking about today, because these next three links, actually all four of these discuss the issue of using unencrypted email if that's what the patients want to do, and they all come to the same conclusions. They look at the same question, they give you the same analysis, and come up with the same answers 4 times in a row. I guess that means it's pretty well set. The bottom link is for some guidance on access to PHI that it first came out in 2014. It has been recently updated with additional information for dealing with substance use disorder situations and opioid overdose situations and things like that. So take advantage of the guidance that's out there. Now, when we're talking about access to information, people have access to what's in their designated record set. See, there's all kinds of stuff that's protected health information. All kinds of stuff that has the patient's name on it, okay? It could be appointment information, it could be internal review documents and evaluations and things like that, okay? But it's the stuff that patients have a right to have access to is just the stuff that's in the designated record set. That's the things that you would call like your medical records and your billing records about individuals, okay? The things that you collect and the things that you use to make decisions about the individuals, about how you're going to take care of them or about how they're going to pay for services and things like that. Now, pay attention. This does include information that you have received from other providers. Now, what this means is individuals have a right to know, what were you thinking? What information were you relying on when you made these decisions about my health care? They have a right to know what was the picture you had in mind, okay? They have a right to know all the stuff you received from somebody else. This is for an individual access request, and you may be in the habit of not providing copies of the information that's been received from other providers. That would be an appropriate thing to consider under a release of information under an authorization, something like that, or sharing information for treatment purposes. You wouldn't necessarily want to share the information you receive from other providers, but the individual has a right to see all that, okay? So it's an individual access request. Remember, that's not the same as sharing information under other parts of the regulations for treatment purposes or under authorizations or whatever. That's not the same thing. It's an individual access request, okay? So people have a right to look at the whole picture, all right? So that's something important to keep in mind. It does go against a lot of established habits. So you have to have a process for the individual to request access, and it has to be to be able to provide copies for a reasonable cost-based fee. You can't charge people to be able to look at their information. You have to be able to provide it for them to see. Okay, if they want to have copies, you can charge them a reasonable cost-based fee just for the making of copies, but you can't charge them for what it takes to collect the information. People have a right to have access to that. And if your systems are so messed up, and if your records management is so messed up that it costs you a big amount of money just to provide access to information, you got to change what your habits are in your organization, and you got to start looking for a way to do that right now before you get run over by this issue. You have to have a process for managing denials of access. If you say no, you have to have a reason why, okay, and you have to manage that process appropriately. People do have a right to see the entire record and the designated record set. Those are things that are used in whole or in part to make decisions. People have a right to get electronic information electronically, but there's information you can withhold. That doesn't include laboratory information now. Individuals have a right to have access to their lab information. But you do have a right to withhold various things like psychotherapy notes, or information that's been collected for various administrative proceedings. Or also, there's a number of exceptions for release of information that might cause some harm to an individual. So you want to make sure that you consider all these things that might, because the information could harm somebody who's the individual, or harm somebody else related to the individual, or somebody else altogether. You have to consider all these various things in deciding what to deny access to. So you have to make sure that you carefully look at these exceptions and consider them according to an established process that you define. So here's something you want to make sure you have set properly in your policies and procedures as far as fees and access and processes are, and how you manage denials of access and things like that. But I got to let you know that access of information was one of the two areas they looked at in the privacy rule in the audits that they did in 2016 and 2017. So make sure you do it right. Now, what you want to do is, where possible, steer patients to your portal. Most new EHR systems give you some kind of a secure portal, so you want to try and have people use that, but keep in mind that your portal may not necessarily give you access to everything in the designated record set. So if somebody says, I want a copy of all my information, you have to understand what that is, and make sure what isn't reflected in the DRS is made available, because you have to be able to accommodate reasonable requests for communications of the information you get, and so you have to be prepared for dealing with things like email access and things like that if they don't want to use the portal. So you have to be ready for people wanting information that's not in the portal, people that may want information maybe in the portal but don't want to use the portal. And of course, you have to be careful in how you're setting costs for electronic copies of records. You can't charge people inappropriately. Now, here's the two sections they look at in the regulations when they talk about do people have the right to communicate using plain email if that's what they want to do. So you can see in 164.522, you have to allow people to request, and you have to accommodate reasonable requests to communicate by alternative means or at alternative locations. Now, normally that means something like, call my cell phone, not my home phone, or send information to my P.O. box and not to my home address, something like that. Okay. Well, they look at that and they say, well, if somebody wants to communicate using, plain email, that's an alternative means or something like that. Okay. And also, they look at 164.524 about providing access, and you have to provide access to the individual in the form or format requested by the individual if you can handle that, okay? And if not, you have to figure something else out. And if people also have a right to ask for electronic copies of information that you're holding on to electronically already. If you don't have electronic copies, you don't have to make it electronic. But you have a right to see electronic copies of whatever you have. So anyway, you have to consider these kinds of requests. And if people say, listen, I want to communicate with you using plain email, that's the form or format I'm requesting, and that's what I want to do. Again, what they suggest is you have to explain what the risks are to the individual, but they do have a right to exert their rights under 522 and 524 to communicate the way that they see fit. So when you're looking at the risk issues, each risk issue that you've got has a potential impact and likelihood. It's always a matter of how bad it would be if something goes wrong, and how likely is that to be a problem. Okay, so when you talk about some of these situations, you talk about what's the information that we're talking about. It could be relatively low sensitivity information, could have a relatively low impact. Okay, so it's the kind of thing where it's maybe the kind of thing where the individual says, yeah, I can accept this risk. Okay, but the idea is the individual is making an informed risk decision about what's important to him about their own communications, and they're not giving you permission to communicate insecurely. they're requesting that you communicate insecurely with them, okay? So the idea is to make sure that you address these risks and then explain them to the individuals to get their consent. Now, in the 2016 guidance that I've been talking about, just to give you a few slides on that because it really is rather helpful, they talk about the individual's rights to a wide variety of health information, and also the fact that if somebody has designated somebody to be a personal representative to make health care decisions on their behalf, they're allowed to exert all the same HIPAA rights as the individual would, including access and deciding who's going to receive the information, because that's one of the things, too, is individuals can say, I want a copy of my information, but I want you to send it to my lawyer, or send it to my brother-in-law, or send it to me. But when people are making individual access requests, they're allowed to designate a recipient of the information. The individual's personal representative has the same rights. It acts as the individual. You can require there be a written request for access. You can offer an electronic method. You need to make sure you're verifying the identity of the person who's requesting the information. You have to use your professional judgment and make sure you have some kind of a process in place to do a few checks to make sure you know who you're talking to. You have to make sure that you don't use any unreasonable measures. You can't require people to come in person only, or by web only, or by mail only. You have to accommodate a variety of reasonable ways of providing access. And when it comes to providing and denying access, you have to provide it in the form requested if you can readily do that, including electronic or email. They say it needs to be done in a timely fashion. Your fees need to be cost-based only. There should be free copies, what they say, but there is certainly no charge for viewing records. But they sure would like it if people could get copies for free. And certainly what a lot of states do is where you have individuals who are on public assistance, they are allowed to get copies of their records for free because, you don't need to have it, put them in the poorhouse to get copies of their records so they can be taken care of by public assistance. So that kind of makes sense, right? Okay. So there really should be free copies and no charge to view records. And as far as denying access, it is limited. You have a process you have to go through, and you have to make sure you have that process in place for handling denials as well as access. Now, also what they talk about in the guidance is people have a right to direct their information to somebody else. They can say, send it to my brother or whatever, my brother-in-law, to my lawyer, or to myself, or to my mother, or whatever. So what they say is in the guidance is it should be in writing, signed by the individual. It could be an electronic copy, though, as well. It doesn't need to be a piece of paper. And when the individual is directing the information to somebody else or to themselves or whatever, it makes no difference as to what the fees are and what kind of form and format and manner of access and things like that. These are all the same kind of rights, no matter where it's going. It's not just if it's going to the individual, but based on an individual request, you follow the same standards. And as far as fees, they say it is only the labor for copying, not for reviewing or fetching the documents. And whatever kinds of supplies are involved in postage, okay, whatever costs you to make the copies. But there's no fees allowed for just viewing records. And the fees are set by the actual or the average cost for a type of request, and you might use some kind of flat fees for electronic copies of records, so long as those are reasonably determined. They say want to avoid using per-page fees for electronic copies of records because that, in many cases, just doesn't really make sense. You can't charge for people to review their records or to use the portal. And also, when it comes to state law or HIPAA, whichever costs the consumer less. You may have some conflicts between state law and HIPAA as far as what to charge people. And whichever gives the patient a better deal is the one that prevails when it comes to those kind of conflicts. And also keep in mind, though, if the information is provided via an authorization process instead of an access request, then there's no limits on the fees. Okay, so an access request is a particular thing that the individual does or the representative does for them. But that's a particular thing that has limits on the fees, okay? Releasing information via an authorization is an allowable disclosure, and you're also allowed to charge whatever you want to for that. So you have to make sure it's clear when people are asking for information, is this an access request or a release via authorization? And you have to make sure you provide the appropriate charges depending on what's going on. Again, they're not the same thing. Access and authorization are separate parts of the rules. Also, you cannot withhold access for non-payment of fees. If they haven't paid their doctor's bills, they still have a right to see their records about what happened. Okay, and you cannot charge people for looking at the records or making their own photo of their records. It's only if you make copies that you're allowed to charge them. And when the individual designates a recipient of their copy, then it's the same fees as individual access. And it needs to be transmitted securely, unless the individual requests something insecure, like plain email. Otherwise, otherwise you need to do something secure. needs to be their request to do something insecure. They go in more questions and answers. They have lots of categories, and in terms of what information is covered by the access right and timeliness, and also in the format and manner of access. They point out that if the individual requests insecure transmission and a breach results, the entity is not liable. Okay, because that's what the individual asks for. See, I don't care if it's insecure. And something goes wrong. Well, guess what? The entity is not liable because that's what the individual asked for. And also the entities are allowed to consider their own security in deciding how to provide access. In other words, if somebody wants to say, hey, listen, I want to bring my hard drive in and plug it into your system so you can load it all up with all your medical records that you have on me, you can say, no, we don't know where that hard drive has been. We don't know what's on it. We don't know it could try and attack our networks and our systems for all we know. So, no, we'll figure out how we're going to get you the information in a reasonable way, but we can certainly deny certain processes that we think would be a security problem. And also, when it comes to dealing with these security problems, I mean, what you have to think in terms of is making sure you have a good process in place, okay? When you're dealing with, preventing various problems and having things go wrong, you want to make sure that you consider how to protect the information properly, okay? So you have to establish your information security management process. The idea is you have to protect confidentiality, integrity, and availability of all this information we're talking about communicating, right? And so you have to manage your security process. You have to understand what you're dealing with. I mean, it's basically any business process. You have to understand things. You have to watch things. You have to walk through issues, review things on a regular basis, and make changes based on bang for the buck. Well, that's your basic management process. Well, you basically have to apply that notion to the whole issue of information security. How do you protect confidentiality, integrity, and availability? So if that business process notion, and the idea is you have to understand what your information is, where it's moving around, how well protected is it, what are people doing in your networks and systems, what kind of things are happening. And that's what security is all about, is knowing these things and controlling them, and learning from various incidents and doing regular audits and reviews. And also, whenever your operations, your environment changes, when things change in the world, you may need to call a meeting and figure out what are we going to do to deal with this. Okay, well, it's the same thing with your information security management. It's a continuing process, and then you make changes based on reducing your risks, which is kind of the converse of making more money. I mean, if you can't make more money in your organization, maybe you can cut your risks and save some money in the process. But again, it's confidentiality, integrity, and availability that you have to consider. And you have to put in place a security policy framework so you can deal with the issues that may be coming up when it comes to electronic communications under the security rule. So you have to make sure you cover all the various safeguards that are called for. Put the various policies into various groups, I think, makes more sense. In the regulations, they talk about administrative, physical, and technical safeguards. Well, if you try and break down all your policies in that way, it becomes pretty unwieldy. So it makes sense to talk about all the things that are security management, whether they're administrative, physical, or technical, in one bundle. It makes sense to talk about all the things that are access controls, whether they're administrative, physical, or technical, in one bundle. Basically a user policy, all the things your general user needs to know in the organization. Put all those various things that have to do with the administrative, physical, and technical safeguards they need to know in one place. Okay, so just because they use that as a good way to explain the rules, that doesn't mean it's a good way to organize your policies. You want to organize things in a much more sensible way. You want your policies to give you the right that you need to have good security practices, and then you put your details in the procedures, which will tend to change more frequently than your policies. Your policies should be stable for years at a time. Of course, document all your procedures. You are never done documenting procedures. There's always room to document more procedures. Never stop. Keep going. A lot of time every week. Spend 10 minutes a week documenting a new procedure, okay? You won't realize that in no time at all you'll have a lot of things documented. That if you have a situation where maybe you have a flu goes through the office and you lose everybody who knows how to do things the right way. You've got some procedures you can rely on to figure out what to do. You have to have some policy in place, and check your own policies on this to deal with using insecure communications with patients. Remember that you can't use insecure communications between professionals, but you want to talk about what what your normal means of communication is, and what you might want to deal with for an insecure alternative, like maybe plain email, if you can handle that. But you want to require the patient to request using something insecure, and then have them indicate how they want to communicate, and if they want to do something that you haven't considered before, then you want to make sure that you consider that according to regulations in 522 and 524 and the guidance in the guidance document. And if you do something that's insecure, You have to make sure you explain the risk, get their consent with a signature if that's appropriate, and then make sure you get the word out in your organization. You have to let people know this is how they want to communicate. Okay? It doesn't do any good for you to say, oh, yeah, we'll communicate with you using a plain email, and then you don't tell anybody. Okay? You got to get the word out. This can be very complicated in some organizations. And, of course, you have to document the request and denial, all this kind of stuff. You also have to have a good portable technology policy in place, because when you're talking about texting, quite often you're obviously dealing with things like portable technologies, okay? So people need to know to use these things securely, make sure they have the proper physical and technical security in place on these things, make sure that they're set up with the proper passcodes and encryption to protect the information on them, make sure that you have some kind of a process for approving the use of these things with any health information, including what the required settings would be for protecting the devices and what kind of required app you would use for your texting purposes, things like that. As well as having the thing set up for auto wiping or remote wiping if the thing gets lost or stolen. Also things like how you maintain your passwords, and do your best not to intermingle your personal and patient emails and texts as well as photographs. Okay, you don't want to mix your patient photographs up with your vacation photos. That leads to some very embarrassing situations. That can be reportable breaches. People need to be aware that using PHI remotely from the office is still subject to controls. You have to make sure they protect the information, and they have to make sure they tell somebody if they have health information on the device and it winds up being lost or stolen. You can't just sit back and go, well, yeah, my phone has been missing, but I think it'll come back. Yeah, it'll probably come back. Well, I had it on the table at the restaurant, and I went to use the restroom, and I came back and it was gone, and I asked, and nobody saw anything. So, maybe it could come back. It's been a few days, and maybe it'll come back. No, guess what? It's not coming back. Okay, so make sure you deal with it as soon as it's missing, and don't be like, oh, I don't want to wipe it clean because it has all my pictures on it. Well, come on, be smart about this and make sure you have all your pictures properly backed up. Anyway, the cloud, it's trivial to do these days, so make sure you do it properly. And make sure you clear the device before you trade it in. Every fall, we all get this glazed look in our eyes. We go, I must go to the nearest Apple store and trade in my old iPhone, which is now useless, and must have the newest one. And, they keep pushing us to use the new ones. And so people go, I got to get rid of the old one. Well, make sure you get any PHI off of it before you trade it in. It gets really hard to reach out to it and clear it once it's been turned in. If you're looking for some security and incident policies, there's some sources available that can help you out. From SANS is a great resource for all kinds of security resources, not just policies, but all kinds of newsletters and things like that. New York University also offers some useful resources just in terms of giving you some examples of what some decent security policies look like under the HIPAA regulations. So take a look at those NYU policies. You want to see what some decent security policies look like. They can help give you an idea of what kind of scope and content you need to have in your own policies. But the SANS resources are really fantastic. You also want to make sure that you have access to the NIST guide, National Institute of Standards and Technology Guide for Cybersecurity Event Recovery. That's SP 800-184. And also make sure you are familiar with a really great document from NIST. It's 800-61 Revision 2. It's a practical guide. They're not kidding. It is a practical guide to responding to incidents and establishing a computer security incident policy and process. That's pure gold, okay? Make sure you take advantage of that document. And there's some additional guidance on 800-61 from one of the Information Technologies Laboratories bulletins in the past. So avail yourself of these resources to help make sure you're handling your information appropriately, especially when it's electronic information, all right? We're talking about texting and email. We're talking about electronic information. You want to make sure it's properly protected. If something isn't properly protected, what happens? If you have a situation where you have an acquisition, access, use, or disclosure that's in violation of the privacy rule, you may have a breach on your hands to report, okay? So a breach is any acquisition, access, use, or disclosure in violation of the privacy rule. And any of those things happen, your first question is, oh boy, is this something we have to evaluate as a reportable breach? Okay, well, you have to look and say, well, first of all, do we meet any of the exceptions for unintentional internal use in good faith with no further use, or an inadvertent internal use within job scope? These are the kinds of things that you look up the wrong record by mistake. You're supposed to be looking up the record, you happen to see the wrong one. That's not a breach. Or if you put a folder of papers on the doctor's desk, but you put it on the wrong doctor's desk, and the doctor says, oh, this isn't for me, it's for the other doctor. Again, these are all within your organization. These are unintentional or inadvertent in good faith, within job scope, all these kinds of things, okay? Or if you lose the information, get it back, and it hasn't been opened or viewed or anything like that, you get it back and hasn't been damaged. Maybe you're mailing some records to someone. You went to take them out to the car, and you put the records by your car, and you got in the car and drove off, and you forgot to put them in the car. And you get back and you realize, oh, there's that box of records. It hasn't been opened. It's still sealed just the way it was when I left it, okay? Then you don't have a breach on your hands, okay? It's also, though, if you don't meet one of these exceptions, the next question is, well, was it destroyed in the process? Because then it's not a breach. But was it secured? Was it properly secured in this situation? Because when you look at the regulations, when you get to the end of the regulations, they talk about all the various things when it comes to reporting breaches, and you only report breaches of unsecured information. So that means if the information is properly secured, you never have to report it. So your next question is, if you don't have one of the exceptions, okay, then, well, was it properly secured? If it was, then you don't have to report it. Otherwise, if it wasn't properly secured, you have to go through a risk assessment to see, well, what's the probability of compromise? And, of course, the word compromise is not defined anywhere by HHS. NIST has some definitions of compromise that are pretty scary. It's pretty much if you lose control and you don't know what's happened to the information, it's been compromised, okay? So you have to do this evaluation to see if there's a low probability of compromise based on what is the information, where to go, was it actually looked at or not, has the problem been solved, has it been mitigated, you know, how sensitive is the information, all these various things you have to think about. But, you know, you look and see, well, you know, if you misfax some highly non-sensitive information, very, you know, low-risk information, very poorly identified information, to the wrong doctor's office, okay, well, it goes to somebody else who has obligations to protect it, and they look at it and they see on the routing sheet that it's in the wrong office. They don't see any patient information on the cover. You should never put patient information in your fax routing sheets so they can be discovered, and you can be called, and they can call you and say, hey, listen, we found this problem. We didn't look at the documents. We have put them in the shredder. So you can say, yeah, the information wasn't very sensitive or very well identified, went to somebody who's supposed to protect it, wasn't actually looked at, and the problem has been solved, has been mitigated. So you can say, yeah, there's a little probability of compromise in this situation. Other situations, it gets much harder to say so. You have to evaluate them very carefully to make up your decisions. The overall process for evaluating a breach is you look through and see, well, do we have a violation of the privacy rules in acquisition, access, user disclosure? Yes or no? And then if you don't have a violation, okay, well then you're okay. But if you do, then you have to go, okay, well, do we qualify for an internal exception, or is there some way it can't be retained, or was it properly secured? Basically, step your way through here, and you get to the bottom. And if you have to do your risk assessment for a probability of compromise, then you do your final evaluation as to whether you have to report or not. But the important thing is, as you go through this whole process, when you're deciding if you have to report something, make sure you have plenty of documentation of your going through this process of doing your evaluation and coming up with your determination. You have to be able to show what your thinking was. If you can't show how you got to where you got, they might get very cranky with you at Health and Human Services. They might say, well, how come you don't have proof of how you thought about this? You have to be able to justify your thinking. Now, as far as learning from breaches, learning from past breaches, you can look and see that breaches are caused by hackers and loss of PHI and theft of PHI, malicious insiders, and user errors. So now what you can see here is user errors are the kinds of things where people use the wrong app or they send stuff that's not properly encrypted when it should have been, okay? So those are the kinds of things that when you talk about email and texting, those kind of issues you can deal with there. But, and actually the malicious insiders and user errors are about equal in terms of number of breaches. There's still plenty of information that's lost or stolen, and the hackers are still causing plenty of problems. But breaches are prevented by having good processes that encourage people to do the right things at every step of the way, okay, that encourage people to make the right choices and do the right things as they're handling information, okay. And you need to have good security methods that help protect the information and help it secure it wherever it's possible, encrypt it wherever it's possible, and good people who are, good people, okay, well, you know what that means, okay? Good people who know how to do the right thing carefully. They've been properly trained and are careful to do things in the right way, and they have good hearts, okay? So if you have good processes, good security methods, and good people who know how to do the right thing carefully, they're not going to click on the link or open the attachments that they really shouldn't, okay? They're going to do the right things and help your security be better. If you don't handle your breaches properly, you wind up with enforcement penalties. I mean, if you don't do your best to avoid these situations and try to avoid these problems, and not do what you're supposed to, you can lead to some big penalties. Trends and breaches are, hacking is way up. Ransomware is a big problem. Still is causing all kinds of problems. The latest big name victim is LabCorp. They just got nailed with a ransomware attacking their systems. But when you're still talking about something that we can deal with today, that we can fix right now, it's all those laptops and portable electronic devices, like those things you might be using for email and texting. Make sure those things are properly secured. Okay, should be in your policies that way. Check your policies. Of course, we still have malicious insiders as a threat, but we have all kinds of issues, and I'm actually seeing large breaches being reported in the email category now. You didn't used to see those very much, but now people are realizing that you can have a large breach of information, like sending an unencrypted file full of patient information to an unsecured email service, something like that. Those are the kinds of things where you discover, yep, have to report that as a breach. These things are actually showing up now. Small breaches, mostly onesies and twosies, mostly paper handling mistakes. So what do you do about breaches is, make sure you're prepared to deal with the hackers however best you can. But probably the biggest issue that you can address today, again, is these lost or stolen portable devices. So encrypt whatever you can. Anything that can walk out of your office, okay? If it doesn't have data on it, or if it's properly secured, that can solve a lot of problems for you. You can avoid a lot of problems. And have plenty of safeguards on your portable media. Anything that has to walk around, make sure you know how to make sure that it's properly secured when it's walking around. And then you have to audit your systems and access to be able to find these problems that might exist, and make sure you train everybody to do the right things. Make sure you have plenty of security awareness going on to get everybody up to snuff on what they should or shouldn't be doing. And check your fax numbers and addresses on a regular basis so you don't wind up faxing things to the hardware store or the auto parts store. These are things that I've had reported to me by clients. Now, if you wind up in an audit situation, the question is, what is a HIPAA audit today? The HITECH Act in Section 134.11 requires HHS to conduct periodic audits, but apparently the current administration has decided the period should be about 1 million years because they've decided to cancel the audit program and not have any future audits. They decided Phase 3 will be a report on the best practices learned from Phases 1 and 2, which is kind of a cop-out, I think. But anyway, did round 1 in 2012, and for round 2, they did in 2016 and 17, they just asked about 2 areas in the privacy rule, and just looking at patient access. That was one of, it was notice of privacy practices and patient access were the only 2 areas they asked about in the privacy rules. That's how important it is. But they have canceled any further audits under the audit program for the time being. Of course, it could be restarted if there's a change in administration, obviously, because it is in the law. Now, if you want to find out what you might be asked in some kind of enforcement or investigation about your compliance, audit or enforcement investigation, you want to be able to look at the kind of questions that have been asked in the past. So these are all resources that you should take a look at and see how would I answer these questions in these various circumstances, okay? Work your way up. You can maybe start with the 2008 document. If you haven't looked at that one before, it's a great place to start. 2 sides of 1 piece of paper gives you a good security overview, just 2 pages. And then work your way up to the audit protocol that covers privacy and security and breach notification, and ask questions about particular sections of the rules all the way along and see if you've got everything in place that you think you need to have. If you can answer all these questions and feel pretty good about it, you're ready for the cops, aka HHS, to come along and ask you questions that you may have to answer. Kind of interesting what they discovered in the 2012 HIPAA audit program, where they actually just looked at things in general, covering everything in the rules. Okay, this does actually reflect on an issue that we're dealing with, okay? Well, now, first of all, in the overall category, the small covered entities were about 1/3 of the sample, had about 2/3 of the problems. Healthcare providers were about half the sample and had about 80% of the problems. And security findings are about 2/3 of the issues. So just looking at these 3 things here, you could very easily conclude that small healthcare providers tend to have security issues. I don't think there's any surprise there. Now, those security issues are things like, user activity monitoring and authentication, media reuse and destruction, risk assessments, and managing user access and things like that. Those are all important considerations when you're talking about communications for sure, but also like these privacy issues. Look at the top 5 issues here. 3 of them have to do with providing access, having the proper review process for denials of access, and failure to provide appropriate patient access, as well as looking further down the list to disclosures to personal representatives. You have to make sure that you follow the process according to rules for your providing access, and if you're denying access, making sure you do that appropriately as well. There's a number of issues when it comes to access, and it's not to be treated lightly. But it does all obviously tie in with texting and email, because when you're talking about texting and email, you're talking about people accessing their information. Now, if you wind up violating the rules, there's a number of tiers for the enforcement penalties. If you do your homework and something goes wrong, you do your reasonable diligence. That starts at $100, but you might be able to use an affirmative defense if you've been good and haven't been willfully neglectful. You also have to look and see, well, maybe it's a reasonable cause situation. That's the kind of thing that can start at $1,000. You're doing your best to be in compliance, but you're not being, not neglectful. But you may be able to get a waiver, okay? Well, if it's not reasonable diligence or reasonable cause kind of a situation, then you get the world of willful neglect, where we're talking about a conscious, intentional failure or reckless indifference to the obligation to comply with the rules. Okay, that means you should have you should have known about this. There's no excuses for not knowing about the rules these days, is what they say. And if you decide to ignore the rules, if you think, conscious intentional failure or reckless indifference to the obligation to comply. Oh, HIPAA, schmippa, who cares, right? It's just some rules, I don't know anybody who's been to jail for HIPAA yet. Well, I don't know anybody, but people have actually served some time for criminal violations of HIPAA. So, you can't really ignore the rules anymore. That would be considered to be a willful neglect situation. Those things start at $10,000 and very quickly, if it's not fixed within 30 days, goes up to $50,000 per violation. And here's the thing you got to watch out for is these $50,000 per violation. These can be multiplied by the number of people who are affected, perhaps. And they also be multiplied by every day that goes by. Okay, so if you have a situation where you're ignoring like some requests from HHS, and they don't like your reply, and you're not paying attention to what they want you to do, they can hit you with a $50,000 penalty on a daily basis. And so whatever violations you've got, they can be multiplied by the number of different sections of rules that you violate, and also by the number of people that are affected. So there's lots of ways to multiply these numbers, and how you get from a $1.5 million maximum up to these current maximums that they're running into these days of $5.5 million and things like that. So take advantage of what people have learned in the enforcement actions. So go to the compliance enforcement pages and look through the various actions. There have been about a little over 4 dozen settlements and 3 penalty situations where people didn't settle. If you get to know those situations, you'll learn a lot about what not to do and how to protect your information properly and how to avoid issues with compliance. So you want to audit your own compliance, okay? You want to make sure that your own policies and procedures, your notice of privacy practices, reflect the rules and the guidance that's out there and your own practices, okay? You want to make sure you're handling any denials of access properly. You want to make sure you have a good process in place for reviewing any reviewable denials of access. Make sure your fees don't exceed HIPAA or the state maximum, and review your practices regularly to see if your preferred practices are actually working. Make sure you have consents in place for people using insecure communication for when the patients request that, because you are allowed to do that, but you want to make sure that you don't inappropriately expose the information without having those consents in place. And verify that you have good documentation of any insecure uses, making sure that anytime you're using information insecurely, that you're doing so appropriately according to the rules. And you want to review any of the exceptions to your preferred practices. If you start to go outside of what you're familiar with to do special things for your patients, make sure you review those things and make sure you're doing your best to meet their needs and be secure wherever you can. Always have to keep evaluating these things and make sure you're doing the best you can. And, of course, obviously, verify that you're using secure communications for all your professional to professional communications, okay? Because you really have to make sure that when it comes to your own office and people within your office talking with each other that use situations that use any protected health information, that has to be done in a secure way. Either using a secure email or secure texting, whatever. You can't just use the plain stuff that's not properly secured. So where do you start? You have to find out what people are doing already. You have to start asking some questions. Say, what do we do in this office? How people are actually using their phones? Okay. You want to make sure you consider professional communications and patient communications separately. Okay, there are a couple of different things. They're really separate aspects of your communications in your office. I mean, you really have to look at your professional communications, your patient communications, and your personal communications as separate things, and make sure you have ways to deal with these things as separate communications processes. Document your processes for the right way to communicate with patients and professionals. Secure anything that doesn't have any patient information in it for professional purposes. Offer secure patient communications for them but make sure you are able to deal with something where the patient says, I don't want to use that, I want to use plain email. Make sure you can deal with that. If you want to deal with texting, make sure you have a process for managing it. That's the whole thing here. And make sure you have a clear process for discussing the risks and having the patients indicate how they want to communicate with you with some documentation of that. Okay, so make sure that you're prepared to deal with their requests. So your to-do list is, don't be in denial, okay, first of all, because willful neglect costs more than compliance, okay. With the penalties these days, you can spend a lot less on compliance than you can on the penalties in no time. If you're able to accommodate the individual rights for access and things like that, and review and update your own policies and procedures according to the rules. Everything we've talked about today, you need to think about your own policies and procedures and see if you have those things properly covered. Establish your processes for risk analysis and documentation, and document these various communications policies and procedures you've got. You can't just keep it all informally. You have to write all this stuff down as to how you do this sort of stuff. Make sure your notice of privacy practices is properly updated to reflect your practices, and train your staff in any new policies and procedures that you adopt. You have to make sure people know how to deal with these things as you make adjustments to your policies and procedures. And, of course, document everything you're doing. Anything you're doing for compliance purposes, make sure you have full documentation. If you're doing, like, a breach evaluation, okay, make sure you have plenty of documentation of all the steps you take to decide whether something is reportable or not. And then if something is reportable, make sure you have documentation of all the things you did in support of that reporting. Make sure, if you have to report to the press for some reason, then you have to make sure you have documentation of that, showing, who did you send it to, and show copies of the news stories or the TV reports, things like that, or, news clippings that may have resulted from it. So you have to have plenty of documentation to prove you've done all the things that you're supposed to do and show you've thought about things. The more you can show how you've thought about things, the more you can show in your documentation how you've considered all your decisions, the better off you're going to be. What HHS does not like is coming into a situation of finding where things are done properly and people haven't really thought about it very carefully. If you can show you've thought about it and have good documentation of your process, you're much less likely to wind up in trouble. That's just the fact of the matter. Then when you think you're all ready to go, conduct some drills in your audit and breach response, okay? Be prepared to deal with these situations because they're going to be a surprise, okay? Practice having something go wrong. The important thing about drills is these are the kinds of things to do when you're in life and death situations. If you have a breach that occurs, if somebody loses their laptop, okay, you want to know how to deal with that. Otherwise, the CEO is going to be breathing down your neck, and you're going to start making mistakes, expensive mistakes, and start doing the wrong things and notifying the wrong people. And make sure you can practice this stuff, okay? Once you think you're ready to go to your list of who has the laptop, okay, or who has a phone that's being used for some communication purpose, okay, or whatever, some device. Go on your list of who has these devices, and just choose a particular device to say, okay, this device is now suddenly lost. It's suddenly missing. We don't know what's happened to it, okay? What do we know about this? Okay, it's disappeared. So now you got to figure out, well, is this device properly protected or not, okay? Is it the kind of device that, is it designed to automatically encrypt all the information on the device? And does it have strong passwords? Do we have the ability to be able to wipe this thing remotely, okay? So practice going through all those questions and figuring out what to do. And if it is something that you have to report, that's important to practice that as well, okay? So practice having it go a couple different ways. So when it does actually happen, I mean, look, every organization, like 95% of all healthcare organizations have a breach within every couple of years, okay? So it's going to happen to you at some point. So practice having it go wrong, and practice being able to respond to an audit request by, going through the audit protocol and answering all those questions. Okay, then you can say, hey, somebody wants to ask me a question about this section of the regulations. Well, what do you have for this particular section? You can say, yeah, well, I got all this stuff written down here about how I answer all these questions in the audit protocol. So here's what my resources are. Here's my answers, and here's my documentation. So do your drills. You'll learn a lot. It's how you save the life of the organization sometimes, because otherwise it's like, if you don't practice your skid control and somebody winds up sideways in front of you in a snowstorm, you can crash into them and kill them. But if you practice your skid control that you learned decades ago, you have the opportunity to steer around them and avoid running into them and make your way home safely. But it's only because you practice these things. Because when you have these circumstances, you won't have time to figure out what to do. You have to do what you know how to do based on your drills that you've conducted. And then make corrections based on what you learn. Always have a plan for going forward. Always have a plan saying, here's what we're working on next, and then make sure you keep that updated.